Hormone-based contraceptives, like some types of oral pills, injectables, and some implants, often come with side effects that can range from slightly annoying to bad enough. The most common side effects may include nausea, vomiting, spotting, low sex drive, mood swings, dizziness, and headaches, among others. Dr. William Nyombi is the program manager in charge of maternal and child health at Uganda Health Marketing Group. He says most of these side effects are similar to symptoms of early pregnancy.
When you take the pills, you deceive your body that you're pregnant. So the brain goes through the whole process of commanding your body not to become pregnant again. And because of that, you get symptoms of early pregnancy. And likely, when you've been using this method for the first time, that's when you develop those. After some while, the body gets used and those disappear and you'll never get them again.
But many women have given up family planning altogether or even fear to get started on it because of fear of side effects. Before choosing a birth control method, one should go to a trained health worker who then tells you what to expect and how to manage or prevent the side effects.
That service provider will give you a painkiller, for example, for the first time when you're starting to use family planning methods for the first time, such that when that headache is to come, you take this painkiller and the headache doesn't come. They will tell you, when you're, for example, swallowing the pills, swallow them when you're going to sleep at night after supper, such that when that nausea thing comes, you're in bed sleeping. Take your pills almost at the same time. Today, if I take my pill at 9 in the night when I'm going to sleep, tomorrow I should take around the same time. I'm not saying 9 exactly, but take around the same time of 9. Things to deal with bleeding, because it's one of the major complaints women have on injectables, like Injectaplan or Depo-Provera. So there is medication they give you when you go there, okay? And then it will stop the bleeding. In actual sense, if bleeding doesn't stop, sometimes we even tell these women to go for STI checkups. Infections. There are very many infections which are sitting in the bodies of women and they are not aware. And immediately you take in Depo-Provera. That is an injection of family planning. These infections will actually, together with Depo-Provera, bring what we call overbleeding.
Side effects are not the only reason one should seek professional advice before getting onto a contraceptive method. Women with certain disease conditions like hypertension, liver disease, pancreatic disease, and varicose veins are not supposed to take oral combined contraceptives. Older women above 35, smokers, and breastfeeding mothers as well should not take such pills. But there's a big number of women who are not using contraceptives because of the myths and misconceptions associated with family planning. Many women claim modern contraceptives will cause infertility, abnormal babies, or non-stop bleeding. Others claim certain methods are not suitable for their blood group. In fact, no method can guarantee 100% protection against pregnancy, which rules out the infertility theory. What varies is the length of time each method takes for return to fertility.
When you go on Depo-Provera or Injectaplan, when you take it for at least some time, like 2 years, 1 year, and above, you might take some months before you return to fertility. And the normal is usually between 6 months to 12 months before you return to fertility. But you are not going to become infertile. You return to fertility. Sometimes again, when people hear, and in most cases I've had women who claim I've gone into my menses for 3 consecutive months and I'm not coming out. Sometimes people hear stories from others. That's one of the things I've found out. Because you cannot bleed from Monday to Monday for 30 days, for 60 days and 90 days and you don't die. But some women, for example, get what we call spotting. They see droplets of blood on their knicker, for example, and they say, I'm bleeding all through.
Other misconceptions are related to weight gain and weight loss.
Most of those who have lost weight, we've tried to follow them up. And one of the biggest things we found out is that they will never cancel the proper on management of side effects. So they start getting worried of the side effects. Depo-Provera, as an ingredient in the injection or in the implant, is known to boost the appetite of a woman. But if I've counseled you and I tell you that I'm going to give you this injection, your appetite might go a bit higher. Not very high, but slightly higher. Please observe your eating habits. Okay? You'll be able to observe your eating habits. But if you're not told, and the appetite slightly goes higher, and you don't know why it has gone high, for you to continue eating anything that comes, you're likely to put on more weight. The second thing is peace of mind.
On the plus side, some birth control methods do have positive medical effects. Women who consistently used some methods have reported more regular periods, less painful and lighter periods, as well as low risk of anemia. More evidence points to reduced risk of developing cervical and uterine cancer when on contraceptives. In Uganda, out of the 23% of women who use contraceptives, only 18% are using a modern contraceptive method. Studies also show that 41% of women would like to use family planning but are unable to get them because of one reason or another. Experts say with the current cost of living, more people will need family planning to be able to have the number of children that they can afford to look after. Natukunda, NTV.